Welcome to Democratic Television, a program of the Santa Clara County Democratic Party that brings insights, perspectives, and attitudes of our always thoughtful Democratic guests. Today we have a treat. We're joined by Leona Butler, the CEO emeritus of the Santa Clara Family Health Plan. Did I get that right?
You got it absolutely right.
Oh, good. That'll be the highlight of the show, I think, is me getting that right. And Leona, we have a lot of things to talk about. So let's start off with talking about you. Where are you from? Where'd you grow up? What were your majors in elementary school?
Elementary school, right. Probably boys. Yes, well, I think because of the show, we're talking about Democrats and so forth, it's really important for me to say I come from a family of Roosevelt Democrats.
Oh, okay.
You know, my grandmother, who really basically raised me, thought that Roosevelt walked on water.
Yeah.
In fact, he probably did.
Probably at least for a few of those years, yeah.
A few years he did. And very much Union people. Had an uncle who was a longshoreman with Harry Bridges.
Oh, no kidding.
Yeah, right. And then my mother, my father unfortunately died when I was very young, about 2 years old. And my mother went back to work and was very involved in starting the department store union in San Francisco.
Oh, local 1100.
1100, right, exactly,
Yeah.
local 1100. And I was about 4 years old, maybe 3, walking the picket line with her.
No kidding.
I still remember some of the songs that we sang as we walked the picket line. There was one that went, there are the bosses getting sore, standing out the door or something.
Oh, wow.
You know? Yeah.
That's great. It sounds like just for another show, too.
It may well be.
So you were walking a picket line at 3.
Yes,
so
right.
I can tell you're a woman of values.
Well, and I actually come from a series of very strong women. Grandmother raised 7 children. Her husband died, and the 7th was born.
Wow.
And
the husband died?
Her husband died,
Oh.
That's right. And so she raised these 7 children, and then my mother had a rather similar experience, but with just one child. And then the war came along, and I was, of course, very little. I was hardly a thought in anybody's head.
I'm sure.
But the war came along, and her mother said to her, "What's a strong woman like you doing for her country?" So she went off to Treasure Island and worked for the Navy, driving a huge truck.
No
throughout
kidding.
the Second War. Yes.
Oh, wow.
So it was great fun. But it was a family that very much valued the worker and the contribution of the worker, and felt very, very strongly. I remember my grandmother saying, who had come from Ireland, in this country you can be whatever you want to be and do whatever it is you want to do. Woman, man, black, white, yellow, whatever.
Right.
This is a country where you can achieve what you want if you really work at it. So that's, I would say, a very strong value that I was raised with.
Yeah, and I can tell in that some heroes that you probably looked up to, what we now call mentors.
Oh, absolutely. And of course, she was very much one of them, as indeed was my mother. And, you know, it's kind of interesting, Steve, because people, you were asking about what I majored in. People always say to me, what was your career path? Because, of course, I ended up as a CEO of a health plan, taking care of 120,000 people. Pretty well, actually. I wish I could say it was a straight line.
Yeah.
You know, there's a series saying God writes straight with crooked lines, and this was very much a crooked line because actually my interest was theater.
Theater?
Theater. And my total background was theater arts.
No kidding.
Yes, absolutely. Went to a drama school from the time I was about 12 years old. Studied drama, you know, majored in drama. And then went to New York and did some off-Broadway.
Wow.
And that's where I met my husband, and we went off and did a marionette show.
No kidding.
Wow. In fact, that's how I met him. But coming back to San Francisco, then felt, well, reality has set in. I have to work. But my real interest was to direct and write for the theater. So an opportunity finally came along in which I was able to think I was going to get unemployment. the people I was working for had moved their offices to Benicia.
Oh.
And I did that for a while, and I thought, well, this is my chance to quit the job, collect unemployment very legitimately, because it's traveling to Benicia is ridiculous, and do some writing for the theater. So I quit the job, and they were very in favor of my collecting unemployment. That was fine. But I lived near UC Med Center.
Oh, okay.
And so I thought, you have to go and apply for a job, right? If you're going to collect unemployment.
Right.
Yeah. So I thought UC Med Center is perfect because I can put in an application and I can keep putting them down because they're so big, whoever knows whether or not you were there. So I went to UC Med Center one day, cold, had no resume, wrote out an application in hand, handed it in, and said to the receptionist at the HR office, bye. And she said, wait a minute. We may have a job for you. And I thought, that's exactly what I thought. And so she sent me to the chancellor's office, who was looking for an analyst at the time. And I was very discouraging when I went there. I did not want the job, and I tried to let that kind of be known because I didn't want to get hired. I got home, the phone was ringing, and they said, the chancellor will be in tomorrow. He was on sabbatical. Would you please come back and be interviewed by him?
Oh.
I thought,
Blowing your plans.
And in fact, I got hired.
Okay.
So I went to work at UC Med Center, and this was my first real job in healthcare. I had no background in healthcare at all, but started to work at UC Med Center, got interested, and then eventually along came Dr. Philip Lee, an incredible man.
Sure.
I don't know if you've ever interviewed him on this show.
No,
but
haven't.
One day you should. The history that man has. His father founded the Palo Alto Medical Foundation.
Sure, yeah.
He still is a professor emeritus of both UC Medical Center and Stanford Medical Center, and still teaches at Stanford. So Phil came along and actually gave me some marvelous opportunities. I was involved doing analytic work for him and starting the family practice program, starting family practice physicians. Wonderful opportunity. And then when he finally left as chancellor, I did have an opportunity to do a television show across the country on healthcare. Meanwhile, I had been taking classes at UC Med Center, so they decided I had the equivalent because I got this big grant. They had the equivalent of a master's, so they gave me a master's for absolutely no good reason.
Fortunately, there's a statute of limitations, so you can share all this.
No, it was, I had actually fully earned it, but not in the usual academic way.
Right.
Not in the usual academic way at all. And so from there, had the opportunity eventually to do something that very much fulfilled what I felt should be done. I had been working on helping people understand more about their health on television, not in front of the camera, but producing it, in fact. And then was able, after that, to go to work for Art Torres, who was at that time the chair of the Assembly Health Committee. Met Art through serving on some committee with him.
No kidding.
Yeah, and it was Health Whose Responsibility was the name of the project we were working on. He said, I need some real world people. Why don't you come work for me? Which was absolutely marvelous. Willie Brown was becoming speaker at the time.
Oh, okay.
And from going to work in the health committee, he then asked me to be the chief consultant, which is a title. It's not a consultant like we usually think. It's a title in the legislature on Medi-Cal, which is where I got tremendous experience in Medi-Cal and what the needs of people are, because not only were we working on the policy issues, a number of things, we were reforming the Medi-Cal program at the time, but also because of my position, I worked both for the Republicans and Democrats as well for their constituent issues that they couldn't get solved.
So that would give you real life cases, situations
Absolutely.
where people were going without and the horrors that did to families.
Well, yes, and I'll give you just one example, Steve. of a woman who was being denied transportation to the doctor. And she was an elderly woman on both Medicare as well as Medi-Cal. But she was being denied the transportation. And so in looking into it, what did I find out? She was being denied it because she was going to the doctor every week, to different doctors. Well, why was she doing that? Getting down to the bottom of it, I found out that was her only social life.
Oh.
And so her way of having a life was she'd make these doctor's appointments, get the transportation, and the transportation, you know, they go around and collect a lot of people, so she'd talk to people in the van. She'd get to the office. She didn't care if she had to wait 3 hours. She would talk to people in the waiting room.
Yeah.
And so what were we able to do for this woman? We were able to save a whole lot of money and make her life a whole lot better by getting her into adult daycare where she could go and get the socialization that she needed without having to, you know, see a doctor every week.
Right.
And be, you know, kind of a drag on the system.
Sure.
Because nobody had bothered to really find out what was going on with her. And I found out so many situations like that where people were being treated as a number and not as a human being. And that's probably working there for the legislature and seeing all of that is what really, if you will, converted me into a real desire to do something in healthcare that would truly help people.
In other words, something that would make the system work.
That's right.
As you thought it should be working, and you were working for Art Torres,
right,
now chair of the Democratic Party, who's a longtime leader in trying to make things like this work for people, real people.
And I have to tell you, Art was wonderful to work with and for, because he cares. He cares about people. And so if I would go to him with an idea for some legislation or problem, he always was supportive. And I think to this day still is. I know he still is.
Yeah, yeah.
So I left the legislature when he was running for Senate and was going to move on. He felt, you know, he'd done what he could in health. He wanted to go on to some other issues in insurance and so forth. So I left the legislature then and went actually to work for Blue Cross and started the Prudent Buyer Plan.
No kidding.
The largest PPO in the state, and in fact in the country at the time.
Wow.
Yeah.
Well, that sounds like a good place to take a break. When we come back, we'll take up the story and see how learning how to work with marionettes plays into the Leona Butler story.
I'm Congresswoman Anna Eshoo, and I'm really pleased to say a few words to you today. One of the most often asked questions of me is, how did you get involved in this? It was 1960, I was a high school student, had to be 21 to vote, but you could organize. And so 783 students later, and many, many, many weeks of organizing, election night, I saw John F. Kennedy become President of the United States. Now, what's the relevancy today? You can do the same thing. Based on your passions, bring them to us, to the Democratic Party. If you care about the environment and preserving it, come to us, because we care about that. If you want quality education for all children, that's what we care about. If you want a health care system that delivers for everyone, come to us. Call area code 408-445-9500. You have a place for us, and together we can remake America into the kind of place that every citizen is proud of and deserving of.
Welcome back to Democratic Television. We have a lot more to talk about with our guest, Leona. When we took a break, we were talking about your involvement with Blue Cross and all the good work you were able to do there.
Right, but you know, Blue Cross was about to go for profit, and I am not a for-profit type of person. It's just not my nature.
That's why we love you.
And so I got the opportunity after I left Blue Cross to actually start a health plan for the poor. And this was in Santa Clara. It's not in Santa Clara, but it was in San Joaquin County.
Oh.
where the state had decided it was going to try to provide for some health plans that were not-for-profit, were public agencies, accountable to the public, abided by the Brown Act, and would be in competition with the Blue Crosses. And so I was asked to go and start that kind of a plan.
Because it sounds very novel and really no roadmaps to follow.
No, and I thought, I wasn't very anxious to go live in San Joaquin County, frankly, because I'm very much a Bay Area person, but I thought healthcare has been very good to me, and it's time for me to give something back. And how often do you actually get a chance to start from scratch a health plan and really build it and leave a mark? And this is for, again, the most vulnerable of people, the people on Medi-Cal originally is what it was for. So I started the health plan of San Joaquin. And from there, and that was an interesting experience because our first offices were 4 desks, a Xerox machine, 1 computer in the airport. And I use that term advisedly, of Stockton. Built it to something going very, very well. It was going extremely well, but I was then asked to come to Santa Clara County and take on the Santa Clara Family Health Plan, which had started, but it was kind of fumbling a little bit, again with Blue Cross as a competitor. So I was very happy to come to Santa Clara County, have loved it ever since, and was able to go from 30,000 people in, this was 1997, to today we have roughly 120,000 people in the plan. And not just Medi-Cal, but also Healthy Families, which is the program for the low-income workers, the children of low-income workers. And what I'm probably most proud of anything, Healthy Kids, which we started in this county thanks to Working Partnerships USA and their help, the help of so many union people, and also PACT, people acting in community together, the faith-based people who together had decided, somewhat separately, that the most important need in this community was that all children have health care. And so the group went for funding at a wonderful time because there was lots of funding available through the tobacco tax and the tobacco settlement money. And the Board of Supervisors of Santa Clara County was so responsive and said, not only are we going to see to that the children in San Jose have health care, but all of Santa Clara County. And I was given the very enviable job of actually developing what that was going to look like and how we would do it for kids. Not only that, but also of raising the additional money that would be needed. So we estimated there were, at that time, about 72,000 children in this county who had no health insurance. We also estimated that there were only about 18,000 who weren't eligible. Why weren't they eligible? Because they were either undocumented or their income was higher than the federal guidelines would allow for healthy families. Sure. And I felt very strongly that if we got something for all children so that we met that gap of the 18,000 children, we would be able to cover all 72,000 because others would come. And bless the Packard Foundation, which was the first to step up and say, we would like for you to prove that, but in the meantime, we will give you the money to help.
Wow.
And they came forth with a very substantial sum. So we had them, the California Endowment, California Healthcare Foundation, eventually the Blue Shield Foundation, Wellness Foundation. All of this we raised the money for.
And this was something that really hadn't been done elsewhere.
That's right.
Getting to be beyond an experiment. This was real.
Oh, this was not an experiment by any means. And I'm very proud to say that what we started has been replicated throughout California and, in fact, throughout many other states in the country. We have been able to fund very consistently approximately between 10 and 12,000 children. First 5 must be mentioned as one of the wonderful funders for children up through age 5 because they have funded all of those children. And as a result, my hypothesis was true. The children who had not applied for Medi-Cal or Healthy Families, that they were able to be eligible for were coming in and applying. And why was it? It was because we had so many families that were mixed. One child might have been born here, another child born in Mexico, and the parents would be afraid to apply for the child who legitimately was able to get coverage.
Right.
So now, at this time, we really have the great confidence of the community. We're funding most, but not all of the children. We have a waiting list of about 1,500, and not the money. It's about $1,000, roughly $1,000 a year to cover a child completely, not only for medical care, but also for dental and vision.
$1,000 a year?
A year. And full coverage. No co-payments, no deductibles, no nothing.
So you're at a point now where the system doesn't have the money for those relatively small number, but
that's
important
right.
to find it for them.
And of course, what our big effort now is that we've been so reliant upon the city of San Jose has been generous, the county's been generous. These are communities that today need every penny they can get.
Right.
The foundations have been extraordinarily generous. Everybody now has done their share, and it's time for this to become a permanent program of the state and, in fact, federally.
Well, and Leona, you, I'm sure, are able to articulate how much cost savings is built into our community when you get the full health care coverage.
Well, just to give you one small example, thanks to the Packard Foundation, we've had Mathematica, which is a nationally recognized research organization, study this program from the very beginning. And they determined that the first 2 years, when we were just starting, first 2 years, we brought in to the community $24 million that the community would not otherwise have. That is in federal money.
Oh.
$24 million.
Money that people were eligible for.
That's
but
right.
Didn't pursue.
We were able to pay physicians with, and we were able to see to it that dentists got the payment they deserved and so forth. So yes, indeed, and who knows what it is now. But the other thing that the Mathematica study showed that's so important is the effect of children having coverage. The missed school days dramatically went down because children weren't sick. Now, what happens with that? You know, we talk about the workforce. The person not only is able to send the child to school regularly for a good education, the parents are able to work because they don't have to stay home with a sick child.
Sure.
And so that in itself is so economically to our advantage, not to speak of the well-being of the parents and the child and all the children. Can you imagine a child sitting in a classroom with an abscessed tooth and the parents aren't able to afford sending that child to a dentist to get it fixed?
Right.
And that has happened. The greatest need we saw, interestingly enough, was not in the medical area, although that's great, but it was in the dental area, where for the first year, a child would come in and never have seen a dentist. So the initial costs of getting the child up to speed were enormous. Now, once the child's teeth were fixed, they became like any other child, absolutely normal development in terms of what was required for their teeth. So tremendous need is there. Now, I want to mention another need, Steve, before we get through, because we have to see to it that children get coverage. And, you know, there have been a lot of really good people working on this issue, and I know the Speaker Pro Tem and the Assembly Speaker, they're all very much involved in trying to make this happen. It's got to happen. But the other thing that needs to happen long range is we need to see to it that our entire county, and in fact the entire state, has access to good medical information through electronic medical records.
Yes.
And why? Okay. Let's say that you see a doctor today, you get some tests done, and you're traveling, and you're in San Francisco or somewhere, and you get sick.
Right.
If you had an electronic medical record, those tests wouldn't have to be done all over again. In fact, that happens not just if you were in San Francisco. It happens all the time if you go from one doctor in the community to a specialist. Things are done all over again at a great cost because there isn't the electronic ability to have information passed. It can be done today in a way that absolutely takes care of the confidentiality of a patient so that people don't have to worry about that.
Well, that sounds like it's your latest passion, and what I'd like to do, we have about a minute left, is ask you if you have some contact information. Do you have a website and an email address for people who want to pursue this?
Absolutely. First of all, the health plan, which I'm still very connected with, Santa Clara Family Health Plan is www.scfhp.com.
Okay.
And I can be reached through that address at lbutler, Butler, at SCFHP, Santa Clara Family Health Plan.com. Good phone number is 408-439-0722.
Okay, that sounds great. It sounds like your next project is going to be to work on the electronic records.
Definitely.
Emeritus or not, you're still out there fighting for folks that need this kind of medical justice. And Leona, thank you very much for being on Democratic Television.
And thank you for asking me.
Oh, sure. Thanks for watching Democratic Television. Give us a call at 408-445-9500 or visit our website, www.sccdp.org. Help make a difference.